Hi, this is Dr. Mora. I'm an orthopedic surgeon in the city of Orange. Just wanted to tell you about a really interesting case I just finished doing. It was on a patient who was in his 20s. About 2 years ago, he ruptured his pectoralis major tendon. That's the tendon that's found in this area. It is the one that gives you the power to push off. So when this tendon ruptures, it's usually due to forceful type of activities. I often see this in weightlifters or in MMA fighters. The tendon, which runs from the chest wall and attaches down to the humerus, it ruptures and then it shrinks down or retracts and it ends up right in the armpit area. So what ends up happening is the initial pain that people feel at the time of the injury goes away. So people oftentimes think there's nothing wrong with them, or maybe they just had a sprain. But with time, what will end up happening is the shrunken up muscle, it puckers, it looks unusual, and then they lose their power to push off. So what they'll notice is that they can't bench symmetrically. And that's what happened to this gentleman. It happened about 2 years ago. So he had the classic findings. He had the puckered chest, he had weakness with push off, he had a positive MRI that showed that the stump was in the axilla area. So that presents a real difficult situation because you're dealing with a shrunken down tendon that's unlikely going to be able to be pulled all the way back to the humerus bone. So when these situations arise, what I tell the patients is, number one, do you think that the weakness is affecting your function to the point that you're not satisfied? And in this case, the patient wasn't happy with their situation. And then I let the patient know that sometimes it's not a repairable problem, and that so I'll make an incision, I'll find the stump, I'll pull on it, and it can't be brought back. And if that happens, the patient is aware that they will end up having a graft, a cadaver graft, that will bridge from the bone to the muscle, and then that will provide a attachment, so then they'll get some of their strength back. It's never as good as a primary early repair, but it will help. So in this case, even though it was 2 years old, I was actually able to release the muscle, the tendon. I was able to pull on it and attach it firmly deep into the bone using these special little drill holes and special anchors that act like cleats. After I attached it, it was actually done with very rigid sutures so that I was able to even move the arm up, and you can see the nice contour of the chest wall reform. And once that was done, I put a little membrane of amniotic tissue, and that's used to prevent adhesions. I do that because one of the main side effects of this type of repair is they still have the puckering effect, and that really bothers patients. So I put the amniotic membrane on there, closed it up, and did not have to use the cadaver graft, with the Achilles cadaver graft. So that was really good news. But the lesson here is really one that I think is really important, and that is, even if you have a chronic tear, sometimes it's repairable, and sometimes it's actually repairable back to bone, just the way it would be done if it was an early rupture. So there's still hope for patients who are walking around with a ruptured, shrunken down tendon, with a deformity and with weakness, and even if it is a couple of years out, it's possible that they can regain some of their strength. And in the case that I did today, it was actually possible to reattach the tendon back to bone using very gentle techniques to pull the tendon back and then reattach it in a bulletproof type way so that they can get some power back very soon. So anyway, I just wanted to share that with you. It was nice to see that it was something that I was able to do and repair without using cadaver graft, which was really nice. And it was also a nice lesson to know that even if you have a chronic rupture, it might be possible to reattach it back to where it came from. So that's it. This is Dr. Mora just saying hello. Please let me know if I could ever help you with any shoulder problem. I'm in Orange. I practice at Restore Orthopedics and Spine Center. Take care.